Good morning, ladies and gentlemen. Do you hear me?
Yes, we can hear you. Good morning, Doctor.
Sure.
Yes. So let me take this opportunity to welcome you to this webinar. I hope you hear me very well.
Yes, we hear you, Doctor.
We can hear you, Doctor, very well.
We can hear
Yes,
you.
thank you. So today we are having another webinar under the monthly series of webinars under the Water Resources Institute. And every month, as some of you are aware, the last Friday of the month, from 11 a.m. to 1 p.m., we have a webinar. And for today, the subject of discussion is sanitation. And we are privileged to have Dr. Swaib Semiyaga, who is going to be our speaker. But before he comes in, we are going to get some remarks from Professor Charles Nwagaba. I hope he's online. And also Brenda Achiro, who will be our moderators. Otherwise, on behalf of the Water Resources Institute, I want to thank you for sparing time to attend this webinar. And I hope that you'll enjoy it. Just also to mention to those of you who are doing good work out there, we would want to invite you to come and share with Ugandans so that they can know the good work you are doing and benefit from it. Otherwise, thank you very much. And let me hand over to Brenda and Charles to take over from me. Thank you.
Thank you very much, Dr. Calist. Can you all hear me clearly?
Yes, Brenda, we can hear you.
Yes, we can. Yeah, go ahead. You can hear.
Okay, thank you. Again, another warm welcome to this webinar that is going to be very interesting, I believe, looking at our sanitation in unplanned settlements, getting to see what happens with, the vacuum and the non-vacuum emptying facilities as water for people who have been in this space of trying to promote safe fecal sludge management in urban areas, including in Kampala, trying to work together with Kampala Capital City Authority on ensuring citywide inclusive sanitation. I know there are quite a number of challenges that are characteristic of an urban center or an urban setting, including, of course, a number of unlined pits, even in a city like Kampala. Unlined pits, meaning emptying them using a vacuum tanker becomes a problem because of fear of the pit collapsing in, but also the fact that some of the pits that are lined are inaccessible. And so you find that a number of people, because of the unplanned settlement, the truck cannot get to them, the toilets are getting full, and so it calls for a lot of innovation on the approach, a lot of innovation in the kind of technology being used. I know we've worked in this area before, being among the first people to introduce a GALPA, which is a semi-mechanical pit emptying device that is currently giving a service in the city, but again with a lot of challenges that comes with it. So I believe this study, this work by Dr. Swaib is going to be extremely informative, and we look forward to the conversations from all of us as we gain from this wealth of learning. Thank you and welcome again, and over to Dr. Charles. You want to make remarks as well? Thank you. Okay, Dr. Charles, are you online? Okay, I'm not sure that Dr. Charles is on, but whenever he comes in, he will be able to contribute to the moderation. And Water Resources Institute team, I'm not sure how do we do it. Does everyone have to introduce themselves, or should they use the chat box to introduce themselves? Otherwise, we are happy to hand over to Dr. Swaib to take us through the conversations.
Thank you, Madam Brenda. Then they use the chat to introduce themselves. They can use the chat to introduce themselves, and then we proceed with the presentation. And whenever someone asks a question, he can introduce himself, where he's coming from, giving us the names and where they're coming from. Otherwise, thank you, and we'll let you continue with the Dr. Swaib. Thank you.
Okay, thank you very much for that guidance, Madam Gwendolyn. So for the rest of the participants, please feel free to introduce yourself in the chat box, and then when it comes to the time of conversations and asking questions, we will request you to please introduce yourself first, and then you go ahead with asking your question. So for now, we'll delve in directly to listen into the presentation. Over to you, Dr. Swipe. Dr. Swipe, are you online?
Oh, can you hear me?
Yes, we can now hear you perfectly. Please go ahead.
I think the attachments were the ones causing that feedback. Thank you so much. I'm so pleased to be at this webinar. I thank the ministry for the invitation and for the opportunity to give us to present some of the work that we are doing. This presentation or discussion we are going to have today, as it has been portrayed, is about vacuum and non-vacuum technologies in Kampala City. Let me share my screen. Can you see my screen? Yes, Brenda?
Sure.
Yes, Dr. Swipe, we can see your screen.
Yes, Brenda, I think I will communicate much more often with you.
Yes.
So when I put in that full screen, can you see it?
Yes, I can see it.
When I move the slides, can you see them moving?
Yes, the slides are moving perfectly.
Okay, great. Thank you so much, Brenda. I'll disturb you a lot and the whole audience. I'm sorry, I'm not so much used to be a TV presenter or a radio presenter when no one is talking, but I really want to help me to move along with me. Now, this is Swaib Semiaga. I'm a lecturer at the Department of Civil and Environmental Engineering, Makerere University. Under civil engineering, we have this track of sanitation, and I'm one of the staff under this track. Our students, both at undergraduate and graduate levels, are also doing sanitation, and I'm one of the lecturers in that sector in sanitation. We are doing quite a lot of research, right from along the entire sanitation service chain, containment, emptying, treatment, end use. And I think today I feel it fine to share with you some of the work we've done on emptying. Maybe later on we could keep sharing also some other findings. Now, this work, I've not done it alone, but with a team of co-authors, which you see down there, okay? And right away to dive into the presentation, we are talking about vacuum and non-vacuum technologies, emptying facilities in informal settlements. In informal settlements here, we should be aware that we are having mainly on-site sanitation facilities, mainly in Kampala. They are mainly on-site, and when you talk about on-site sanitation facilities, we mean septic tanks and pit latrines. I think these are the most common examples to understand when you mean by on-site sanitation facilities. Now, these facilities, when they are being used, we all know that at a point in time, they get full, depending on the number of factors. Could be locational factors, could be utilizational factors, and so many others. Now, when they get full, in many cases, in urban settings or towns like Kampala, we need to empty them because the alternatives of digging other facilities, other pits is not so is not so common given the space limitations, mainly in slum areas. We don't have a lot of space for having other facilities. So the most common one when a facility gets full is to be emptied. Now, in emptying, we have a number of technologies in operation in Kampala. And in Kampala, we have those technologies which are vacuum-based and non-vacuum-based. And this is how we have separated them in this talk. The vacuum-based, those which use vacuum, like vacuum pump, like all of us know, like the vacuum trucks, like a truck which you sit down there. I think this is a common kind of truck, even on the road. It uses vacuum to empty a pit or a septic tank. Then you have the non-vacuum, or what also Brenda was talking about, semi-mechanized also, like the Galpa that was promoted by Water for People. This is, in this study, we are categorizing it under non-vacuum. And also we have instances here where actually we have people emptying using manual means. We shall see later on in some of the facilities where people are emptying using manual means. Also, that is non-vacuum kind of means of emptying. Okay, so this kind of discussion is intended to talk about these questions. One of the questions is, which sanitation technologies in slums are emptied by vacuum and non-vacuum technologies? Now we know the vacuum and non-vacuum. We want to see which technologies, which facilities are emptied by vacuum and non-vacuum. We want to see the nature of fecal sludge emptied by these different technologies, the vacuum and non-vacuum. And then we want to know which vehicles are used by vacuum and non-vacuum emptying technologies and their area of service. How are they distributed in the city? Then again, we need to know the time it takes for various emptying events. Now, this is key, and I think this is one study of its kind that has gone down to look into the details of what it takes in emptying. I think I've not read any study ever, which is documenting in detail the time taken right from a truck when it reaches a facility, it prepares to empty the facility, the time taken in emptying the facility, the time taken in cleaning up and winding up all the work, and then the time taken to transport the sludge up to the treatment plant, and even the time taken to empty at the treatment plant. Now, this study looked at all this in detail, and this is really important when it comes to planning. Many people were asking me questions before, like say if we are operating non-vacuum or vacuum, how many trips can people make in a day or something like that? And of course, this kind of study answers all those kind of questions, even for planning purposes. So also, I'll talk about how we compare the health and safety of operators, both in vacuum and non-vacuum. And I would like to be a bit brief on each of these aspects, but later on, I'll refer to you, I think, to some publications which you have made out of this work, maybe for further information. Then here, what we did, the study was within Kampala, and we had the station at treatment plant, that is WRI, where we have all these kind of technologies where they are disposing. We have a bay where we have the non-vacuum technologies where they take the sludge in drums, the kind of drums you see. Those drums, they take the sludge to the bay for preparation before it is transferred to the main treatment plant. Then again, you have the main treatment plant that is receiving the vacuum technologies, which are trucks. So this became the main station for this kind of study when it came to bringing to the treatment plant But again, also we had going back to the slums where these technologies were operating from. And we looked at 37 operators of vacuum and non-vacuum technologies, purposefully selected. Now here, we wanted to see the work that was being done. And this one, we just stationed ourselves at the plant, and these people, maybe they're getting work. And so maybe when they're getting work and we get to know where the work is going to be, if it is a slum, then we move with these people to the slum area so that we can be able to document. So this was really hectic, quite a lot of work. If you can move with a truck or with a non-vacuum kind of truck, coming up with 37 operators is quite a lot of work, because we found that non-vacuum, you couldn't even work with them like more than 1 or 2 in a day. And for the vacuum, we could work with about 2 in a day. Then we found at the end of the day, the data we collected from 37 operators was in a total of 7 informal settlements. And whenever we are collecting data on all those emptying events, we are also able to sample also at the end of the process, so that we could compare even the nature of sludge that is emptied by these technologies. And in here, we could determine a number of parameters like solids density of sludge, and also the solid waste content. This was also something that was important for us to determine, because these technologies also, they come with solid waste which are in pit latrines. And again, we are having GPS trackers to track the distances traveled, the speeds the vehicles are moving, and also the time they spent in moving to the treatment plant. All these were studied. Again, we had a study still that was interviewing the people who were, or the operators who were discharging at the treatment plant, both on the non-vacuum side and also the vacuum side. And here, we wanted to have quite a lot of information about the vehicles, and about where they are coming from, the time estimates, and many other things, as some of them I'll discuss them. Then again, when we were in the other operators, these were able to look at the time to set up the equipment, which I talked about, and all these were timed, the emptying process, the dismantling after emptying, cleaning up, packing equipment, and also taking to treatment plant, and time they spent discharging at the treatment plant, where these were all mentioned. Now, these are some of the outcomes of this study. I'll just also request, maybe after outcome, I pause, then I get some feedback from you, maybe what could have been done differently, or what you can contribute to, or a question. It could be anything like that. And of course, also do not forget that from the contributions we are getting from you are always also helping us to always continue having more and more research questions, even for further studies. So such kind of presentations also help us to get feedback, even to what more studies we need to look at. Now, the first question here is, which sanitation technologies in slums are emptied by vacuum and non-vacuum technologies? For those of you who were not with us in the beginning, I want to just re-echo one thing, because we are going to be using it time and again. In emptying, we are talking about vacuum and non-vacuum technologies used in emptying. When it comes to vacuum technologies, these are using vacuum pumps like the trucks, the vacuum trucks. And then we have the non-vacuum. The non-vacuum, they can use equipment which could be manually operated, like the galper, equipment manually operated. And then you could have even other non-vacuum, which would even do it just using manual means, by using just a simple hand tools, like maybe like shovels and buckets and something like that. Now, all those are vacuum. That is the trying to discuss today. Now, on the side of informal settlements, I want us to compare informal and outside informal settlements. Now, we extended outside to informal settlements to have the comparison on the emptying using different technologies. If you look at this critically, you realize that the technologies that we focused on were of three categories. That is lined pit latrines, were the septic tank or septic tanks, and then you had unlined pit latrines. And I hope all of us on this call are well confident with these technologies. The unlined pit, you have a pit that was dug, you have a slab, then a superstructure, people just use, and then it is the soil to drain the leachate from the excreta. Then the septic tank, we know it's a waterborne facility, which could be connected to a soak pit. Then we have a lined pit, then it's like the way you dig unlined pit and then you line the walls. They line the walls so that what is inside can be contained to prevent it contaminating the soil, the groundwater, and many others, and also promoting reusability of that pit. Because in many cases, you'll find that it is the lined pit that can easily be emptied and then reused, which is not the case of unlined. Now let's see what is happening to these technologies. You realize that at least each of the technology, both within slums and outside slums, they had events where emptying was done with vacuum and non-vacuum. You can see that. Apart from only one technology, that is unlined pit latrines. Now, in unlined pit latrines, you see that the only technology which is in use for unlined pit latrines is non-vacuum. Now, this one, I go back to the facilities in Kampala, in slums in particular. We've had a number of studies in slums which report over 60% of the toilets in slums unlined. I think the figure is about 60 to 70%, which are unlined pit latrines. Now, you can see from this kind of study that from unlined pit latrines, the technologies that can operate on unlined pit latrines, whether it is within informal settlement or outside informal settlement, we can see it is only non-vacuum technologies. And you can see that in the informal settlements on the left, we have the non-vacuum technologies taking the center stage to be used mainly because we have a lot of unlined pits which are full, and the easiest way is to use non-vacuum technologies. But again, you can see another thing is the vacuum technology is mainly used. If you look at the vacuum technology, it's mainly used in emptying septic tanks when it comes to outside informal settlements. And within the informal settlements, you see that the vacuum technologies are mainly emptying lined pit latrines from the study. Then also another thing that we can see here, we can see that when it comes to non-vacuum, these non-vacuum technologies here, which you can see, non-vacuum technologies are mainly, you can see that they are also used in emptying lined pits and septic tanks. Now, this is a case where a vacuum technology was reported to be, in many cases, emptying the spanner tank. And when it comes to septic tanks or lined pit latrines that are having thick sludge at the bottom, then these vacuum technologies cannot work. So in this case, the non-vacuum is they bring them to empty the septic tanks and even the lined pit latrines. And finally, here, as we are saying that 38.5% and 60.6% of the emptying events of vacuum and non-vacuum technologies respectively occurred in informal settlements, meaning we have more of these technologies that are non-vacuum. Another reason why they are also prevalent is, of course, the issue of access, that the access for non-vacuum is easier compared to the vacuum ones, because vacuum trucks are big, and then this non-vacuum, they can be drums, which people can move with even in small paths. So that's why it's easy to find that we have a high prevalence of non-vacuum. And even the non-vacuum have a model of emptying like the number of barrels that can be afforded by a household. Also, it can have a pit latrine that is having a lot of sludge, but they can afford to empty maybe 5 barrels. The non-vacuum come with 5 barrels, they pay them per barrel. Each barrel is about 200 liters. Then they take away, and these people just get a small relief, and they continue using the toilet, at least even at a small fee, which could not be done with non-vacuum technologies. Then I think I may need to hear from you about maybe some of the experiences or some of the questions when it comes to these technologies in informal settings. The floor is also yours.
Thank you very much. Doctor, would you want the comment to come in now?
How is it, Brenda? Do you think I should complete, or we should present alongside with some comments?
Yeah, giving it some time of comments makes it also natural. And in case there's anyone who has comments for Doctor at this point, please feel free. I'm looking at the chat box as well, and I haven't seen any comment coming in, but I do see a hand up from Prince. I can probably just take about 3 at most at this time.
Yes.
So Prince, please go ahead.
Okay, thank you so much.
Introduce yourself and submit.
Yeah, thank you. My name is Prince from Abuja in Nigeria. I work with the government of my country here in Nigerian capital. So as an environmental head, handling wash programs and climate change projects. So my question, during the course of your slide, I saw where you analyze how you are using GPS tracking system. And that your narrations there was explaining about the quantities, the volumes, and the average distance or travel limit and the rest of it. But I didn't see any area that captured the issue of sanitation aspect of it. So my question would be that, are you also doing the tracking system to ensure that those trucks were able to go and discharge the load in appropriate quotas? Because if your GPS tracking system does not monitor that, they might collect it from the town or from the community and just went to the nearby bush and discharge. So I didn't see that in your explanations. I don't know if you can clarify on that, sir.
Okay.
Thank you.
Okay, thank you so much, Prince. Yes, actually in Kampala, the situation is a bit different. In this study, we are following the trucks up to the treatment plant. But even then, the organizations here, the MTS organizations are really very active, and I want to commend them for that. It is now rare to find a truck emptying in a place that is not a treatment plant. I think if there could be someone from KCCA or someone from the MTS could say something more on that aspect. In our study, we did not find any that was discharging anywhere else, not at the treatment plant. Maybe someone could come into.
Yeah, I did see a couple of colleagues from KCCA. In case one of you wants to jump in and make your comments, please do. And you could also take the comment on the tracking, in case there's some technologies and approaches you. Yes, please.
Okay, hi, Brenda. This is Gloria Mirembe from KCCA. My name is Gloria Mirembe from KCCA, and I work with the citywide inclusive sanitation program. When it comes to the illegal dumping of the waste, we have an application. It's called the WRI application. It helps us to track the MTIs from where they pick the sewer, the fecal matter to where it is being dumped. Most of our MTIs utilize the app. Once you get they get clients from the application, and also once they get to the field, they are able to switch it on, input the details of the client where they are putting the sludge, and then the volumes, and then switch it on to track where they are taking the sludge from. And at the end of the month, they can be able to look onto the WRI application and know the amount of the number of jobs or the number of trips they've been able to make and how much money they've been able to generate and from what areas they were able to pick the sludge from. So that is how we are able to regulate the illicit dumping of fecal sludge into our drainages or into our environment. Thank you very much.
Okay, thank you very much with that contribution. I think, Prince, it adds to the question. And then also there was a question in the chat whether this could be applicable to other cities. Yes, could be applicable to other cities that could have similar characteristics like Kampala, but let's discuss more and see how other issues unfolded when it came to Kampala in this context. Brenda, you talked about 3 and we move on.
Yes. Yeah, I will just take 2 more and then we move on. So I'll give
then others will be they could maybe
the
have them. We shall have a genuine at the end of the day.
Exactly.
After the presentation.
So let's hear from Zamili and then Mundrugo, and then we will allow you to continue. Yes, please, Zamili.
Yes, good morning, everyone. I really want to appreciate the presenter for this insightful presentation. Gaddafi Nizami is my name. I'm based in Yumbe, northern Uganda. I really want to have a clear picture on the pit options, more especially in the settings and other rural areas. I understand this program is specifically focused on Kampala City, but of course we have a challenge of mindset, and that's the perception towards pit options within the settlements and also communities. And as an institution, what are some of the plans in place to expand this to other rural areas to see that the perception of people is really changed in terms of mindset, so that they get to understand the benefits of pit emptying in different sectors and settings. Thank you.
Okay, thank you so much. I think this aspect draws us further when you look at these results to really adherence to facilities that can be emptyable. In Kampala, we have a situation that is trying to be reversed at the moment, though it is really slow to be reversed, where in informal settlements, a lot of facilities are unlined. But the way you can see these facilities which are unlined, they're presenting a lot of hardships to be emptied. Later on, you'll see that it's not just emptying unlined facilities, but it has quite a lot of implications, as we are going to see later on. So in this shows you that we need actually in other areas to see that people adapt facilities that are emptyable as early as possible, not to wait for the situation when we reach a situation and we are just trying to empty the unlined, and yet in a sense that they cannot easily be removable. The question is not leaving it worse at the household level, but also the emptiers are also faced with quite a lot of challenges, even health-wise, when they deal with emptying unlined pit latrines. So here, I think one of the take-home should be really looking into promotion of facilities that can easily be emptyable, not to wait and deal with the unlined the way we are seeing it right now. Yes,
okay.
I can go ahead. Or...
Yes, we will just take Mundrugo and then you'll continue. Go ahead, Sandy.
Thank you so much for granting me this opportunity, and thank you so much, Doctor, for the wonderful insights that you've given us. My name is Mundubo Sunday James, and I work with the Uganda Red Cross Society as a fecal sludge treatment plant supervisor. Doctor, you threw an insight on the two technologies, that's the non-vacuum and the vacuum, and you said that the vacuum was performing better since they're able to, at the household level, they're able to collect a few barrels as per the need of the household, as per the need of the household, as per the size of the household size income. I wanted to understand probably how the costing of these the fees for the barrels are being conducted, and how does it conflict with what the vacuum emptying colleagues would charge? Thank you so much.
Okay. Thank you so much. I think let me just briefly talk about that. The non-vacuum, for them they charge per barrel, and in Kampala a barrel is about 25 to 30,000 Uganda shillings in these informal settlements. So they charge, if you take 5 barrels, then they multiply that cost of 25 or 30,000 by that amount. Now, when it comes to the vacuum, in actual sense, when we go into the volumes, the vacuum technologies are cheaper because you could find a truck that is 3,000, for example, liters or 3 cubic meter. And that truck, if it is able to access a facility, it can empty it at something like 100,000 or 120, depending where the location of this facility is. But now the challenge here comes in where you have access issues, that even when someone would want to spend that amount of money to empty quite a lot of sludge, you are going to find that they may not have the way of allowing this truck to access. I think this is also going to lead us to the next results, which I'm going to present ahead, and we shall have also maybe more discussion there later on. Okay. Then when it comes to the nature of sludge, the nature here was limited mainly to solid density and the quantity of solid waste, because these deter a lot when it they are really determinants when it comes to emptying these pits. And one thing you can see here that the sludge from non-vacuum was thicker than sludge from the vacuum technologies. It was lighter. Now, I will not talk so much about that, but this thick sludge here, you'll realize that when it comes to design of treatment plants, usually they don't design with this thick sludge, which is from unlined pit latrines, which is from maybe what settles in septic tanks or pit latrines. They usually don't design for such kind of sludge. But now what we realize from this study that you cannot have now Kampala, you can't deal without that sludge in Kampala. That sludge is there because the facilities are there, and there is a lot that is going on in terms of trying to survive with these facilities. So this means now also that it is really pertinent, even when it comes later, to design other treatment plants, to have this add-on on how or what is going to be dealing with a thick sludge before it joins the mainstream of a treatment, fecal site treatment plant. So this is something that is important for us to take note. Also, when it comes to the solid waste fraction, you realize that non-vacuum are having a lot of solid waste. Can you imagine? Can you imagine having about 23% of the content of the fecal sludge being solid waste when it comes to non-vacuum technologies? When it comes to vacuum, it's just about 4% or 4 to 5% of the solid waste in these technologies. Now, how does the variation comes up according to what we saw on ground? One, the variation here is these technologies, when they are being set up, we don't have, the vacuum technologies do not pump out using vacuum the solid waste. So in many cases, they first rake it out, and after raking it out, they can leave it within the environment. They can just dig a pit and then they just cover them. In other cases, if you find that where they have emptied is having maybe a paved area or is an area that is highly residential without having anywhere to dig, they can easily be able to get this waste and then illegally make it join the solid waste stream, actually, which is not acceptable because this solid waste from pit latrines cannot be in municipal solid waste. Now, you find that by the time they reach a treatment plant, the waste they have in their fecal sludge is really low. As opposed to non-vacuum, the non-vacuum, what they do, for them, when they empty, everything they empty in a pit, they put in a drum. So that means even when a pit has a lot of solid waste, the solid waste will go in the drum and it will find its way at the treatment plant. And that's why you find that you have a lot of solid waste also in these pits arriving at the treatment facility. Now, this is something that we need really to be cautious about when we are running these treatment plants. We need to know that we are going to expect quite a lot of wastes. When we are running an add-on where we are having a thick sludge, we should also expect a lot of solid waste coming onto the treatment plant. Unfortunately, we do not have quite a lot of solutions at the moment at the treatment plants to deal with this solid waste in fecal sludge. If you look at further, we took some further studies to look at what kind of waste is found in pit latrines. This was another parallel study, because after seeing that pit latrines have quite a lot of wastes, we needed to go ahead and see the kind of waste that we have in pit latrines. And if you look at this, you could see that by composition, by weight, we have quite a lot of rubble and a lot of textile, polythene paper, sanitary towels, wooden pieces, things like that. So now, these are all contained in our pit latrines. Now, this speaks volumes that what we are emptying, it is put there also by the people. Now, this shows us that there is quite a lot to do to these people, could be in terms of behavior change or whatever, to see that we limit a lot of waste in this kind of category that ends up in pit latrines. There's a lot to do on the social part for most of the promoters of these technologies, be it containment technologies or emptying technologies. There's a lot to do so that we limit the solid waste which is going to be taken to the treatment plants, because these treatment plants were not designed to manage solid waste, but you find that they are going to be receiving a lot if we don't reduce it from the containment side. Okay, so I think if you see that, that's something again. If maybe there is one question or two on the.
Would you want to take a few more, Dr. Swai?
Okay, great. Now, a few more is about the vehicles that are accessing, because here we wanted also to know which vehicles are used by vacuum and non-vacuum emptying technologies and their area of service. Now, if you look at this distribution, you'll see that inside the informal settlements, the vehicles that are accessing this way are from vehicles going there. The vehicles that are accessing, you see that more they are around 3.6 cubic meter. Okay, roughly we can say 3 to 4 cubic meter around there, with the optimal size being about 3.6 cubic meter truck. Now, when it comes to the outside the informal settlements, you will find that what we have more are trucks which are bigger, like trucks which go like 10 cubic meter, things like that. And as you move along to increase the size of the truck, it keeps on dying away from accessing informal settlements. And this is also talking about, this also presents something we talked about, an issue of access, that the trucks also, the vacuum trucks that which can access informal settlements are those which are of smaller capacity, both 3 cubic meter, and those outside could be bigger. But again, we need to know that the bigger the truck to come and empty a facility, the cheaper when it comes to the unit cost of, say, a cubic meter. Because the big truck, you'll find that it takes a lot, and then they charge you a whole sum, and then you'll find that per cubic meter, it's a bit cheaper. So anyone would want to work with that. But when it comes to informal settlements, what we saw, what we can have optimally is between 3 to 4 cubic meter for a case of Kampala. So that means if people want to promote emptying in slums and they want to use vacuum technologies, I think they will have it right when they invest in technologies that are between 3 to 4 cubic meter trucks. Okay, if the purpose is to have more facilities emptied, then we need to look at those sizes of trucks. Okay. Then also, when it comes to the non-vacuum trucks, the trucks for non-vacuum were mainly tricycles and trucks, the pickup trucks, for example. Now, you'll find that again here, within the informal settlements, if you can see this graph, we are going to have more of the tricycles, and I think for also the similar reasons of access, more tricycles here were being used for carrying the sludge from drums, which is emptied from the informal settlements, then to the treatment plant, the whatever. The vehicle they are used was mainly a tricycle, but also trucks were in use. Okay. Brenda, can I continue or?
Yeah, there's just a couple of questions that I can quickly read out. Jane from IRC and Lugoa Dennis had similar questions on whether the findings can be scaled up to other cities. And then also Dennis is wondering whether the application can work in small towns and municipalities. You might want to just
okay, thank you. I think now similarly, if cities are having informal settlements, so if municipalities are having informal settlements, because this one was mainly looking at how we can we can enhance service provision in informal settlements, and we are looking at that side of emptying. So if we have informal settlements even in other settings, could be similar results could suffice, but also studies in those others to know mainly more about their nature of sludge, because when it comes to the nature of sludge, it could be also a kind of localized, may not be what you find here, may not be what you find somewhere else. But for a bigger picture, you may find that in all settings which are informal, we cannot deal without the 2 categories of emptying. That is the mechanized and non-mechanized. It becomes, at the moment, it becomes not possible. Then also, you talked about the app. I think the app is on side of KCCA, and the KCCA is in audience. And now this study was not using that app, or we are not downloading the data from the apps, but these were studies which were carried out within with the emptiers within and outside the informal settlements.
Okay.
Now, again, there's something that we want to talk about here about the time required for various emptying events, and as I said, this is one study that has in detail documented at least what happens during the whole kind of cycle of emptying, and where do we have the issues, or where are the critical events. Now, if you look at on the left-hand side where we have the non-vacuum technologies, non-vacuum, I repeat, these ones don't operate using vacuum pump. They are like gulpers or even manual. Then when it comes to vacuum, these are the vacuum trucks that we are talking about, and things like that. Now, if you look at the left non-vacuum and right vacuum, you are going to realize that in total, the total time spent when we are having when you're having a cycle, an emptying cycle for a non-vacuum, is much more than the total time taken for a cycle of a vacuum technology. You'll find that here the findings we're even rating it at like non-vacuum taking more than 3 times the time required for the vacuum operation. And when you dig deeper where the issues are, you see that the first time considered was time to set up. For example, when any truck or the operators reach a particular area, the first thing they do is to set up the emptying equipment. And here in setting it up, we find that the time is not so different when it comes to non-vacuum and vacuum. It's not so different in setting up. But now when it comes after setting up now, the emptying process. The emptying process, we found that it would take like on average like about 16, 15 minutes to empty using a vacuum technology. But a non-vacuum technology can even go up to 3 hours. You can imagine. Emptying event to complete just emptying, for a non-vacuum, it can go up to 3 hours. But for a vacuum, it's something like 15 minutes, 10 minutes, you are done with emptying. Then when it comes to others, like the dismantling and cleaning up, you take a bit more time on the non-vacuum than the vacuum, because the non-vacuum, you have a lot of spillage, you have a lot to clean up, you are cleaning up the equipment also. But when it comes to the transport, actually, the transportation, the time to travel to the treatment plant, there are no significant differences between the vacuum and non-vacuum. You find that the trucks for the non-vacuum were almost traveling at almost the same speed, because the vacuum, we found that it was traveling like at about 30 kilometers per hour, non-vacuum at about 20, on average 28, 27 kilometers per hour when they are taken to the treatment plant. And also finding that so the travel time was not so different, but when it comes to emptying at the treatment facility, and in emptying, we take more time also for the non-vacuum compared to the vacuum truck. And because here for the vacuum during non-vacuum during emptying, also after emptying, you empty a drum per drum. Therefore, the vacuum is just expelled. Then here you are also going to wash the drums after washing the drums. You also wash the truck that brought the drums. So there is a lot of time during the emptying or the discharge process at the treatment plant. Has quite a lot for non-vacuum compared to the vacuum. And that's what makes the total for non-vacuum to be much higher than the vacuum. Now, this also tells us one thing, that we don't expect non-vacuum operators to have more trips to the treatment plant than the vacuum operators. And the biggest issue here comes with the critical event of the emptying process. That means if we want them to increase the number of trips which are going to arrive at the treatment plant, we need to mind so much about the emptying time. And the emptying time here is determined by, first of all, the nature of the facility. Nature of the facility meaning, if the facility is lined, then it will take less time than when the facility is unlined. So this pushes us back also to having that people are having good facilities or standard facilities, and also preventing the disposal of waste into these facilities, because it also makes the time to be much more during the emptying process. So hence what they are going to take to the treatment plant is going to be less. Now, again, I think the last question here was how the health and safety of operators compare, it was interesting to find that all the operators were not wearing masks from all technologies. Prompting them, I think they get so much used to the environment, and I think this is something that we need to work on a lot. And then some of them get working without them. Then two, you find that occasionally operators for vacuum, they occasionally wear gloves and overalls, but for non-vacuum, that was a big plus that always there is no any non-vacuum operator during the operation that was found not wearing gloves and overalls and helmets at the site. But for the vacuum operators, many of them are reluctant on that. I think this is also something which we need to put emphasis on for promoters of health and safety, and also seeing how this behavior can be adapted, better behavior. When it comes to spills, the spills in many cases for the vacuum comes in when we have the hose pipes that are not well, and I think such kind of operations are needed to check whether people are having standard or having pipes that are not actually punctured or what, because it is also common for vacuum operators, and for non-vacuum the spillage is because of the hard work that is being done in there. And then also another thing here is the operators of non-vacuum are prone to fatigue, backache, and chest pains because they are using quite a lot of manual labor, which you will not find on the non-vacuum technologies. I don't want to take a lot of time, but only to say that we can conclude by saying that both technologies are needed in the city, but we have to be cautious about the details of these technologies when we are promoting them, so that we don't make mistakes. Also, there is a need of behavior change through sensitization on the dangers of dumping waste into pits. This came out strongly as a determinant in emptying time and many others, and also designing wastewater treatment plants and fecal sludge to cater for the thick sludge from the non-vacuum technologies, because we are going to have them operating in the city if you have the services to be improved. Otherwise, there is a lot of sludge which will remain behind if we don't cater for them. And of course, the health and safety is something that is key for us. And then finally, for those of you who may be interested in reading about the details of what has formed the main part of the discussion for today, is found in that paper of adequacy of vacuum and non-vacuum technologies for emptying fecal sludge from informal settlements of Kampala. I think I can say thank you for listening to me. And this study was carried out under collaborative research between KCCA and Makerere University. Okay, thank you so much for listening.
Thank you, Doctor.
Brenda? Hello, Brenda? Brenda could be off. But I think, hello, Brenda?
Thank you so much.
Yes. Yes, Doctor. Yes, please
Brenda.
go ahead.
Brenda, the floor is yours for the discussion.
Yes, thank you very much, Doctor. Again, I see there are some hands that are already up. We'll get to Anne first, and then we'll follow up with Abu Bakr, whom I know is also a bit empty. So you please unmute, introduce yourself, and give your questions. And then I'll also be reading out those that are in the chat box as we go along. Over to you, Anne.
Thank you, Brenda. Thank you, Doctor, for that presentation. I had typed my questions in the chat. My name is Anne. I'm a civil engineer a water utility expert. My question is really on having emptying services in other parts of the country. What is your recommendation on increasing entry of other emptying actors, especially in other parts of the country? We see that many emptying actors are in Kampala, which is understandable, but yet the demand is also in other parts of the country. What can be done to stimulate their presence and stay there? Thank you.
Brenda, how is the mod now? Can I take a bit more questions?
Yes, please, Mr. Abubakari, pass on your question.
By name, hello everyone. Yeah, this is Semkoteka Abubakar. I'm the founder of Brilliant Sanitation, the petty emptier, and mainly we are the one carrying out the non-vacuum. Thanks, Dr. Swipe, for the research. For sure, everything was tackled in the research from the operations of our services. Then I would like to appreciate Water for People and KCCA in the first place for the research, and secondly for the empowerment or the support to the semi-mechanical, or what in the researchers say the non-vacuum MTS. For the guidance and guidelines from the KCCA and Water for People, we've at least managed to uplift or modify our services in delivery and even the costs. Currently, Brilliant Sanitation, we have just opened up a branch in Masaka. Then when we go to some questions about how other people from different parts of Uganda going to access the services, I know that currently we've just opened up a branch in Masaka, whereby people in Greater Masaka can access the services through our non-vacuum emptying. When we talk about the emptying or when we talk about the dumping, my question or my ample request could be about the modifications of the dumping plants across the country. Thanks a lot to Water for People KCCA. We have a dumping in Kampala, which is operating a nice one. But when you go to other places, for sure, we have to apply other means of dumping, which is not easy. So now in Masaka, we had to do some modifications at the plant, whereby now the fecal matter, even the solid waste can be received at the treatment. When it comes to other places, towns, there are some dumping, but the modification or the designs cannot receive. So our request is going to Water for People, our mother, father, grandfather, to please talk to those managing the plants across the country in other cities so that they can receive our content, our sludge. Thereby, we can be able to open up other branches in those cities. Thank you. I'll stop there.
Thank you, Abubakar. We'll take Alan and then Doctor, you'll be able to respond to those three.
Yeah, thank you so much, the moderator. I hope you can hear me.
Loud and clear.
Yeah, great, thanks. Yeah, so this is Alan Chonikane. I work for GIZ Sanitation for Millions program. Thank you so much, Dr. Swipe, for this great presentation and key findings on what's happening in the informal and outside the informal settlement in Kampala. I must say that, yes, this in a way relates to also things that are happening in other towns. Just to respond to the question that was raised by Anne is, how can the actors be the numbers, be increased in areas where people are currently not accessing their services? I must say that GIZ in partnership with Ministry of Water and Environment, we've been attempting to implement what we are calling the cesspool track leasing model through Northern Umbrella of Water and Sanitation, where the cesspool that is owned by the umbrella is actually handed over to the private operator to manage, and to ensure that yes, people in small towns are able to access the service. The operator is then tasked to operate under what we are calling a scheduled kind of arrangement, because we know that he will definitely not serve only one town, but will need to move in other parts of the towns as well. I would like to also make reference to the finding that Dr. Swipe has ably highlighted here around issues of health and safety. Also, as a project, we are currently doing a consultancy that is going to inform the development of operation and maintenance across the sanitation chain. So this is going to ultimately lead to the development of a training curriculum that then the sector can adopt. But also just to let us know is that as a project, we are planning for a side event that will be showcasing some of the things that we are doing as a program in partnership with Ministry of Water to be able to upscale some of these things that Dr. Swipe has been talking about. So mine is basically not a question, but rather to open up for a wider context. Thank you.
Okay, thank you, Alan. That was more of a comment and an update on the investments of GIZ right there. Thank you. Yes, Dr. Swipe, you can then take the first two, and then I'll read out those that are in the chat box.
Thank you so much, all of you actually, for following the presentation. I had a question on on how to attract these service providers in other towns or in other cities. Now, of course, the people now who are so much in Kampala, the model is a bit different. And also in emptying, we have different models depending on the demand or the demand we are having. When it comes to areas like where there is a lot of awareness, a lot of emptying, you're going to find that Kampala has been doing quite a lot of work for people to be aware that they need to empty their facilities, they need to do what. So a lot of things have been done. And now this work has also helped now to bring the private emptiers on board, because one of the most profitable part in the fecal sludge management chain is actually the emptying. So this is where you find the private players. And in Kampala, the biggest part that is doing the emptying are private players. So the environment has been set for them by marketing the services, by marketing the facilities, and then these are coming on board. This has been also tackled by the colleague those who have set up the center also in Masaka to provide this kind of services. You can see now these people, they're all making a profit, so they need to go to towns or to cities where they're not going to be waiting for clients or whatever when they're not getting them. And that's the reason why we have so many of them in Uganda. At the moment, the models which are working in some of the areas where the emptying is not so much, there are different models than the private model. But as also the level of awareness increases, the facilities are being lined to create more of the demand of these facilities, then you see also the emptiers coming in, because this is just a business for them, so they will be attracted by the things in the place. So the environment for them matters a lot for private players. Where we do not have them, then that's when the public comes in. Then the aspect of yes, you talked of the aspect of actually, I think the aspect was more on modification of the of the thick sludge management facilities and also having them. This is really key. And I think as this study has shown that it's very difficult in unestablished, in these cities of ours to not to have non-vacuum. So the easiest way to do is during planning to plan for them. To plan for them whenever we have a treatment facility, to see that we can design a facility which could help to manage this sludge from the non-vacuum MTIs. Otherwise, if we do not do that, even if they come into the city like those ones in Masaka, they are going to end up again dumping where it is not appropriate if we have not catered for them. So in order to have a holistic kind of sanitation enhancement in the city, we need to look at all these different kind of aspects. Key players, themselves who can come together to have these things done. That's in brief what I can say on these questions, but I thank others for the compliments again.
Yeah, thank you, Doctor. Just quite a number of them actually in the chat box that I want us to try and go through before I take another round of those that have hands up. Paul Tipoti had a very interesting question about how have the settlements influenced the sanitation technologies. And then we also have one from Kaga John. He basically wants access to the slides. I believe the Water Resources Institute will avail those. And then Edwin is asking what the key challenges the service providers for non-vacuum technologies are facing, because probably that might be limiting their scale up. And then Stephen from Welthanga Hillfay made a comment about the need to regulate some of the non-vacuum tankers for their safety, a bit of regulation right there, which I thought maybe KCC could also speak to that, things to do with the regulation, but also safety, the different technologies that we are trying to work on together with them. But before giving an opportunity to KCCA, Doctor, you might want to speak to how the settlements are influencing the technologies and yes, what are some of the challenges that are affecting scale up by the non-vacuum?
Thank you so much. Now, when you look at the nature of the informal settlements and how they come up, actually, these informal settlements, if you look at the slum areas that we have so many people in these areas. And these areas, these people can hardly afford other affluent areas which are not in slums. And these areas themselves, you find that the people, like we have a high congestion of people. Now, when the people are highly congested, having a facility which they are going to use for excreta disposal, you are going to find that you may not have quite a lot of space for a lot of these. So the nature of the settlement also is influencing also the kind of technologies. One, the area where they are, because you may find in Kampala, many of them are in low-lying areas. So the kind of technologies in low-lying areas could be different. Then again, the affordability of these people, because this category of people, also they have a certain kind of technologies they can easily be able to afford. So there are many factors that lead them to have such kind of technologies which they have. But as we said that in the city, we have planners for the city, we have investors who are coming up in the city to see that they work maybe with the authorities to see that to improve the status of this kind of areas. It's important for them to understand the picture of what is in there and what kind of things they need to do in order to improve. I remember a project where Water for People was now embarking on providing or embarking on making sure that we have a high coverage of lined facilities within informal settlements. This is a very positive movement because you see that when you leave them on their own, they are just going to have whatever that favors them, but it will have consequences both to environment, to emptying, and even the workers. So it's important for us to know that the nature of people here and the environment it will influence the kind of technologies that they have, and even what will happen to these technologies when they get full. Yes.
Okay. Do you want me to just give an opportunity to KCCA, maybe as we take a glass of water, to
I
speak
think
to...
it will be really important for this audience to listen to them also in this line, maybe even the ministry. That will be something important.
Yes, sure. So KCCA colleagues, I know Gloria, you're online, and so Jude as well. So if you could speak to the conversation around regulation. Okay, someone hasn't muted. Sure. Innocent Tayari, do you want to mute, please? There's a bit of feedback. Innocent Tayari Muizerwa, please mute. Yeah, so if KCCA could please speak to how they are working to control, to regulate the issues of safety with the technology. I know we're having conversations on the different technologies to get a cleaner one, but also there's an element of how do we think we can deal with the solid waste issue. So if you can speak to that from the perspective of government, that would also be helpful. Please go ahead.
Thank you very much, Brenda. So I'm going to speak on the issue of regulation for the emptiers. Of course, our emptiers in Kampala have an association of the emptiers for the vacuum people, the Uganda Emptiers Association for the vacuum tankers, and then also the non-vacuum, which is the Gaupas Association of Uganda. So having them organized makes it very easy for us to provide those capacity building, organize them in terms of how are we teaching them the occupational health and safety guidelines. So within their associations, they have committees that follow up on the occupational health and safety issues. We also look into the issues. We have an ordinance that is strictly for sewerage and fecal sludge management. So therein, it has the different roles of that partners, fecal sludge management is a split, and sewerage is a split mandate. National Water takes what's piped, that is sewerage, treatment of waste, and then KCCA concentrates on the on-site. So what is our role as KCCA, and then also the emptiers? How are we regulating them? So the ordinance helps us to regulate the emptiers because it speaks of the do's and don'ts, and then the penalties that come with not doing what they are supposed to do. So there are also issues of where every emptier is required to have their truck have a big branding of, that hazardous waste. So that hazardous waste, and then the type of company, your company logo, so that when you are seen dumping somewhere, someone can easily identify you and probably report to KCCA or the GAU committees. Then also when it comes to regulation, we issue out environmental sanitation service permits. These ones are issued after recommendation from National Water. So that means if you're not meeting the criteria at the National Water treatment plant, you're probably not wearing your PPE, or you're dumping in a way that you shouldn't be dumping, or you're not meeting their criteria, you'll not get that recommendation. And when you don't have that recommendation from National Water, that means you'll not get the environmental sanitation service permit from KCCA to be able to operate in Kampala. And then you'll also not be able to get a license from NEMA, because all those move line in line, hand in hand. So when it comes to the occupational health and safety, like I said before, we have the guidelines that were set up. We also have when we are doing the sensitizations, since we are public health as well, there are some vaccines that we can provide to our emptiers, and those are for the diseases that are associated with implementing the job, like for tetanus. Those ones we can give to our emptiers. But still also we do the we make sure that we are providing the PPE. Then I've noted down that most of our operators don't, that the vacuum operators don't really use the PPE. That is something we are going to look into. Then someone asked a question when it comes to wiring. The non-vacuum technologies seem like they are the most used, and where are they scaling up? We have limitations of when it comes to safety. You know, this is highly manual, so it involves a lot of spillages and human contact with the fecal sludge. So I know Water for People is going to test out. We tested a pit vac last year. So this year we are going to test out alternative technologies that can be adopted by our Gaupas Association and then scaled up. So we are going to test out the Pupo pump to be able to see if it can be able to be a better alternative to the non-vacuum technologies. Thank you very much.
Thank you very much, Gloria. I think well said right there. If the entrepreneurs are able to follow the regulations of KCCA on safety, certainly the issue of whether they are safe or not should be dealt away with, because KCCA is giving very good regulation and control right there, where the emptiers just basically have to comply. There was a question on taxation. I don't know, Gloria, if it's really for you to take, because issues of taxation are always very difficult. Someone made a comment that the taxes on the vacuum emptiers is high. I know it's a complicated conversation. I don't know whether you want to have anything in that area.
I think that we may not really have a lot of issue. I know it. They tabled it before Parliament because there are very many charges involved. They pay to National Water, they pay to KCCA for a license, they pay to NEMA for a license, they pay to WRI. So it's just maybe us sitting together as the relevant stakeholders and see how can these taxes be maybe minimized, or some of them just be swiped off to ensure that, you know, they are actually getting what they should get out of their business without the high taxation or the many taxations from the different entities.
Okay, thank you very much, Gloria, for that. I'll give an opportunity to Jude, also from KCCA, then those with hands up will continue. Yes, Jude, just please add to that. Thank you.
Okay, thank you very much. Just I want to add to what Gloria said, but I think also the people who are paying the taxes need to understand what the taxes are used for. Really, when you see how much we are charging them to, mainly the money is used for the process, and it's really little money if you compare to what is delivered to them. Because at any stage, they have to be inspected, and the cost of inspection is really high. And also the process running. In fact, when you look at the money we are charging for the license, it is far lower compared to the expenses involved for somebody to get that license. So I think it's all about sensitization, and so that they happen really to understand that the money they are contributing, or their contribution toward this process of licensing is really not just intended for government to collect money, but it's intended to improve their service so that we give them better services. Thank you very much.
Thank you very much, Jude from KCCA. Yes, Mr. Paul Wima, please go ahead and mute, introduce yourself and ask your question.
Thank you very much indeed, Madam Brenda. My name is Paul Wima. I work for Networks, which Network for Water and Sanitation, as Executive Director. I want to thank Doctor for the very educative presentation that he has made. I have a small comment and then a question for him. The comment is that emptying septic tanks should not be compared with the emptying lined pits. People who use septic tanks are rich people. They're a little bit more affluent than the people who are using lined pits. And I'm not surprised that the contents of a septic tank are not the same as the contents of a lined pit. So that's the observation. Now I have a question for the doctor. Now it's about emptying traditional pit latrines. We have had many attempts, many people have made attempts to empty traditional pit latrines, but they are never successful. And your research also presents the same view. You saw that the contents of traditional pit latrines was, in addition to fecal sludge, there was a lot of extraneous material, cobs, stones, rags, and so on and so forth. Now, I'm inclined, therefore, to think it is wrong to empty a traditional pit latrine. And I think we can use your study to advise local authorities that it is wrong to empty, to try to empty a traditional pit latrine. Because another name for a traditional pit latrine is grow and forget. You're not supposed to tamper with it. Now, all these new technologies, lining pits, and so on and so forth, are relatively new compared to the pit latrine. So our laws, the Public Health Act, talks about pit latrines, doesn't talk about this one because they are new. And that law, the Public Health Act, does not allow emptying a pit latrine. They just tell us that once it is within 3 feet, level it up and go and dig another one somewhere else. Now, in these slum areas where we are concentrating the space, I think it is enough to put a ban on emptying traditional pit latrines because nobody has ever done it successfully. So I want to pick on your brains, Doctor, what you think about it. Otherwise, thank you very much indeed. Very, very impressive. Thank you, Brenda.
Thank you, Mr. Luime. Very interesting submission right there. Doctor, would you want to take that?
Okay. Am I loud?
Yeah, loud and clear.
I'm loud and clear. Okay. Thank you so much. Now, when it comes to issues of regulations and laws, I think I'm not so much there. I'm so much in presenting the situation as is. Then maybe we can, based on the situations, to do or to recommend otherwise. The truth is, as Paul has said, we have a high prevalence of unlined pit latrines, and the management strategy of them is to cover and then dig another one. But now a situation has come. This kind of technology was working so well in villages. People have acres and acres of land. They don't need that, those few square meters. They can get other few square meters for a pit latrine. But now here comes to the nature of settlement. And this is why now this prevents kind of unique situations. We had the technology that is much more prevalent in an area where it cannot be sustainably operated. You have an area of informal settlements, you have high unlined pits, and then they cannot be sustainably operated. But now it's a catch-22. You have now, there are many, they are full, and then people want they are still staying there because we are not going to tell them to park and go. Maybe it's not in my docket, to park and go somewhere else where they can find a place to have new settlements and pit latrine. You find even what is happening at the moment, if you go on ground and see these operations, these people are just trying to find a way of having a relief, a kind of a temporary relief. You cannot find that they are emptying all of it. They're just finding a temporary relief, and one of the temporary relief is that one. But as we said, this temporary relief is presenting also a number of issues. So the easiest way, and people were asking, those who have not yet reached the situation of Kampala, the easiest way could be now to have this in plan. to have this in plan earlier on, because if we do not, again, we can come to a situation of Kampala later on, and we are in this kind of a situation where we are trying to find relief so that people can continue having facilities that they can use. Otherwise, again, we are going to have issues of open defecation, which are also happening to some facilities which are not, which can never be emptied. Because you find even these non-vacuum emptiers, I didn't want to go in details. They even ask whether they have ever attempted to empty that facility, because if they have ever, many of them don't empty again. They don't want also they fear for their lives, because there are a lot of risks involved. But that's not the point of discussion for today. The issue here is we have to do something. Where our people are going to go, maybe KCCA can answer a lot on that. Now all the facilities are full. Actually, there was a study where over 66% of the facilities are already full in informal settlements. So those who are emptying are just trying to relieve, but already we have a lot that is already full and nothing is being done. No complete solution, Paul. Sorry, Brenda.
Okay, no, this is great. Great conversation. What to do in a place like Kampala where you cannot close and move to the next place. It's very interesting. Those are the challenges that come with an urban setting. Thank you. I would like to give another round of comments. I see a number of people from outside Uganda. Brian Mulenga from Malawi has some questions in the chat box. If you don't mind, Brian, you can put up your hand and submit. And then after Brian, Winnie Wole can also submit your question. Brian, do you want to go ahead, please?
Hello?
Hello?
Hello.
Hello, can you hear me?
Yes, Brian.
Yes, I can hear you. We can hear you.
Yes. Thank you, Doc, for that informative presentation. I think we have similar situations in Blantyre here, but I just wanted to get your experience in terms of the study you were conducting, in terms of the time. You mentioned about the time spent from emptying up to the time they're disposing. I just wanted to find out if at all in your study you had maybe consideration to see whether that had an effect on the price or the costs the household pays for the service. Thank you.
Okay. Okay. Thank you so much.
Should we take two more, Doctor?
Okay.
Winnie Wole, please go ahead. Unmute, introduce yourself and submit.
Hello, everyone. I'm Wole Winnie. I work in Sesame Engineering Company. I've worked alongside Water for People in constructing latrines around informal settlements in Kampala. My question is going to KCCA. When I worked around informal settlements, usually you encourage them not to throw sanitary pads and maybe baby pampers in their pit latrines, but then they'll tell you, where do you want us to throw them? If we throw them in the rubbish, it will be seen by everyone. So I'm inquiring, is there, apart from depositing them in a rubbish bag that is going to be later taken by KCCA, or the people who collect the rubbish, is there another way to overcome that challenge? That's my question to KCCA.
Thank you, Winnie. Yes, I'm sure someone from KCCA will take that as well. Jude is on the call. He'll be well placed. Let's hear from Sylvester, and then we will give Doctor and KCCA an opportunity to respond. Sylvester Sinanjugu, do you want to please unmute and submit your question?
Hello.
Yes, please
Hello.
go ahead. Go
Yes,
ahead,
mine
Sylvester.
was actually just a question, maybe to pick the doctor's brains. I'd submitted it on as a message. I wanted to know, what are those technologies which doctor feels we could incorporate so that the non-vacuum, the emptying technologies can also dump in the treatment plant. Thank you.
Okay, thank you. Thank you, Sylvester. Yes, Doctor, it's related to another question that was put on the page about what do we do in a conventional treatment plant? What alterations or redesigning should we have to do to receive from non-vacuum emptying tanks similar to that? So please go ahead, Doctor, and then maybe Jude from KCCA to take.
Thank you so much. I think I need to be also cautious of time. It's been engaging. Thank you so much. Now, on the issue of Brian, the time spent and the cost. Actually, the determinants of cost in emptying when it comes to non-vacuum are mainly one, the presence of waste, solid waste in the pit. The more the solid waste you have in the pit, the more you are going to pay. And two, the number of drums that you want them to empty. Those are the two key main determinants of cost for pit latrines. Actually, even I saw another question. Though I may not have a lot of time to go on that, someone asked the determinants of people disposing solid waste in pit latrines. We had also another study which was done on that, which was also on the behavior change, on what determines solid waste in pit latrines. Maybe it may be another kind of time, and we have some kind of discussions also on that, because we had also quite a number of interesting findings on that. I may not go into that, but we've had a study on also the determinants of the solid waste into pit latrines, and the study was within Kampala also, pit latrines. Then the issue on the technologies now, we've also had some studies before on the add-ons, like the treatment plant. Like, so for example, in Luigi, we have that dumping bay. And that dumping bay, mainly its purpose, looking at the what is in thick sludge, mainly the sludge is thick. So when they put in this bay, they dilute the sludge more, and then also they remove more of the solid waste, because in some cases, solid waste is within, embedded into the sludge. So they light it, it becomes thinner a bit. And then when after that, it's taken to the main treatment plant. Now, the issue here is, I want also to interest you that in some studies that we have done before on this thick sludge in particular, we found that the sludge is usually divided into three. The sludge for non-vacuum emptiers, we have divided it into usually three. There is one which is a liquid, like the one in septic tanks. There is one which is semi-solid, and actually there is one which is like soil. Now, these three categories, you find that they have different ways of how to deal with them. And the technologies also can differ. Like, for example, if it is really liquid and semi-solid, this can easily be diluted, and then we can have them to the treatment plant. But when it becomes solid now, you are going to find that you need quite a lot of water. You need you need quite so much to work with it. So you may find that some of these now may be directed. So you may have a drying kind of facilities to directly have this kind of category of sludge. So when we are talking about the technologies, we are mainly looking at these three categories of sludge, and then how they are going to be considered before they join the mainstream on a treatment plant. And we have had some sample kind of designs on with this kind of technologies, but it's kind of a plea that in further designs they should be there, because this kind of sludge is still eminent in a number of places. Yes, I think I could stop on that.
Thank you, Doctor. We're actually, I think, moving towards the close of this very interesting conversation. But like I said, I would like to give KCCA Jude to make a comment on the issue of solid waste. I know the city authority is doing a lot to regulate that as well. Jude, please go ahead.
Thank you very much, Brenda. Thank you very much, Doctor, for the research. About sanitary waste, in our city, in Kampala, it is still a serious challenge, a very big challenge. That even the waste which is being talked about here, when it reaches national water at the treatment plant, it's only about putting it aside and then it sanitizes. The technology we are thinking about is for us to use the incinerators. We tried to, we piloted in Kansanga, those who know Kansanga, whereby we constructed an incinerator, which we thought would be used by both the community and the school, using a model, a business model that was around 2014. Unfortunately, the business model did not work out well because the cost involved in burning of the sanitary waste is high and the school would not manage it. And even the people were not willing to pay for their sanitary waste. And even culturally, we are still having it rough that ladies are not willing to give up their sanitary waste to the known person. It is known, it's supposed to be hidden culturally around here. So we are still grappling and we are requesting for more research. Even we are calling upon people like doctor to come on board, really so that we can come up with a practical solution, which is really we see that I think incineration is not working. But I hope you know that people around here, they are burning, and yet by law, we are not supposed to burn the waste. So that is the situation in which we are. We have piloted, I've already talked about the piloting, but we know that when it reaches national water, the waste is piled up, and with the time, because of denial of mixing with cutting off for the moisture, with the time we expect it to sanitize, and then that's when it's supposed to be dealt with as hazardous waste. So that's the situation in which we are. We are only looking up to researchers to come up with a solution, which is different from incineration, because incineration model did not work out. Thank you very much.
Thank you very much, Jude. Colleagues, I think we are moving towards the close of this very, very interesting conversation. We would have wanted to go on and on, but we have to bring it to a close. I know there are quite a number of other comments that came in the chat. We are not closing the conversation now. I'm sure you can receive Dr. Swibe's contact email address and continue having the conversation with him. I'm sure he's available for that. But also I know colleagues at the Water Resources Institute are able to collate and put all these comments together to contribute to, a resource of, frequently asked questions and trying to get answers to that. I'm sure our colleagues at the Institute do that for all of these webinars, and the conversation continues. I would like to thank you again, allowing me moderate this session. Again, my name is Brenda Chiro Mudemba, Country Director, Water for People. Thank you very much. Dr. Swibe, would you want to make last remarks before we hand over to the Water Resources Institute?
Okay. Thank you so much. First of all, Brenda, for moderating this session. And again, I want to thank also Minister of Water for this initiative of trying to share quite a lot that that we are doing. And again, I thank also the people for being really enthusiastic to learn and to getting to know what is happening, and also contributing to what is happening. My humble appeal is maybe when you find such kind of information, please make use of it, and to avoid always making similar kind of mistakes. If you've seen such kind of studies, which we take time to investigate and really come up with some kind of findings, it will be really pertinent for you to, based on these findings, when you are implementing such kind of things elsewhere, I think it will limit there's so much kind of going through the cycle all the time, all of us. So Ministry, thank you so much for this kind of initiative that bring about such kind of information so that people know it exists, and when they're dealing with planning or such kind of things, they can be able to utilize this information. I can't say anything more than that. Thank you so much.
Thank you very much, Doctor. Very good comment right there also from someone called Annette, that excellent webinar. We are seeing similar issues in West Africa. So we are glad to have been joined by colleagues from Malawi, colleagues from Nigeria. So good to know that this research is actually speaking across Africa. Thank you very much. And with those remarks, I'd like to hand over to the Water Resources Institute to officially close this webinar. Over to you, Water Resources Institute. Okay. I'm also aware there's an ongoing national organizing committee for the Uganda Water and Environment Week. So it is possible most of the colleagues are at that meeting, and I have been asked to close on their behalf. So with those remarks, I would like to thank you all for joining, and looking forward to having you in the next conversation. Let's look out to the different webinars that will be shared by Water Resources Institute. Thank you and have a blessed day and a great weekend. Bye-bye.
Goodbye. Thank you.
Goodbye, everybody. Bye-bye.
Bye.
Bye-bye, everybody.
Bye-bye.